Hello, I'm VA-Accredited Claims Agent John Kent,
And I'm VA-Accredited Claims Agent Vittoria Marini.
and today we'll be talking about back ratings and radiculopathy. Now, Vittoria, when it comes to the back, primarily that's getting rated under the diagnostic code 5237. What are some of the ratings and some of the symptoms you're looking for in each of those criteria?
Yeah, so I think a lot of veterans might be interested in understanding what sort of symptoms they would want to express, say, at a CMP exam. So we can definitely break down what the VA is looking for in the diagnostic code criteria. So the rating for back is actually much more objective rather than subjective, meaning that VA relies on certain range of motion measurements as opposed to expressions of pain level or certain symptoms that you can express, like limitations functionally.
Yeah, absolutely. VA does take into account pain, but only in certain factors. They're all supposed to take flare-ups into consideration, but primarily, if you are looking for an increased rating for your back, primarily is going to be due to that limitation of range of motion. If you're looking for a 10% versus 20%, primarily it's going to be based on your range of motion measurement for the back. Now, if you start getting some of those higher ratings, like 40% and 50%, what are some of the things that you're looking for in those higher ratings?
Yeah, so once you get to the higher ratings, like 40%, 50%, VA starts looking at a term called ankylosis, which is whether or not your back is fixed in a neutral position. Is ankylosis at a 40%, and if you're stuck in sort of a hunched position, over is a 50%. But that's when you're getting higher up into the more severe levels.
Yeah, absolutely. The higher your back rating is, essentially you're going to be either locked in position, whether in a natural standing position, or as Vittoria mentioned, hunched over. But even if your back rating doesn't rise to the level of ankylosis, there certainly is functional impairment that you can consider for individual unemployability, which we have a separate video on. But what are some of the situations that you would look for a back for TDIU?
Yeah, so if someone is going for TDIU, which is VA's unemployability benefit, they would, of course, want to be able to see that your back condition impacts your ability to work. So you can certainly talk about how your back limits you in walking, standing, sitting for certain periods of time, and to be very specific about that, about specific distances in terms of feet or time in terms of minutes or hours. And that really helps paint a picture for VA so that they can see how severe your condition really is.
Yeah, absolutely, certainly. When you're going to that VA examination, the most important thing is to be honest. You're going to not want to underreport your symptoms, but certainly exaggerating can really make a difficult situation for VA to get the benefits you're looking for. But there are some great points on the unemployability aspect of a back condition and back rating. Secondary to a back, oftentimes that we'll see is radiculopathy.
Yes.
What are some of the things that we're looking for when we're talking about radiculopathy secondary to a back condition?
Yeah, so radiculopathy is essentially nerve pain that can go down with a lower back condition. It's down into the lower extremities, and it can go down to your thigh, your knee, your ankles, your feet, all the way into your toes. And VA rates this actually a little bit more subjectively than the back itself.
Correct.
The rating scale is based on subjective expressions of mild, moderate, moderately severe, and severe, and each of that corresponds with a percentage.
Yeah, certainly. And you can find those percentages under VA's diagnostic code 8520. If you would like assistance in filing your back claim or seeking an increased rating, please reach out to our office.
Absolutely. And we also have a separate video on service connection. So if you're looking to get your back in radiculopathy service connected, go check out that video.